All right, so well-woman visits. I think we all could use a bit more insight on this topic. You probably know the basics, but
Mm, yeah.
trust me, there's so much more to these appointments than it meets the eye, right?
Yeah.
We're going to unpack two excerpts today from the consumer version of the Merck Manual,
Okay.
one on obstetric and gynecologic history,
Right.
and then the other on well-woman visits. Get ready to be surprised
Yeah.
by what you might not know.
You're totally right. A lot of people, they think well woman visits, it's just like a quick in and out for a pap smear.
Right, exactly.
But it's really so much more than that.
I'll admit that's what I used to think, too. Check the cervix, see you next year.
Right.
But it's fascinating how much these visits actually cover.
It's really about like taking a holistic view of your health. So we're talking mental health, sexual health, even screenings for domestic violence. It's really a comprehensive approach to women's well-being.
Wow, I had no idea all that was part of it. That really changes my perspective.
It's all about that preventive care. So think of it as catching potential issues early on, managing any existing conditions, and just generally boosting your overall health.
Okay, that makes a lot of sense. So it's more like a check-in on your whole well-being,
Yes.
not just a box-ticking exercise.
Uh,
Speaking of ticking boxes, though, what's the deal with all those detailed history questions?
right.
They always want to know about, like, periods, past pregnancies, even things that seem totally unrelated, like bowel habits.
Yeah, you laugh, but those questions are so crucial.
Right.
It might feel like you're traveling back in time,
Totally.
but clinicians ask them because seemingly unrelated things can actually be super connected. Like, for instance, did you know that an overactive thyroid can actually mess with your menstrual cycle?
Seriously, I never would have guessed that.
It's true, and that's just one example. By understanding your full history, clinicians can get a much clearer picture of your overall health and spot any potential red flags that need further investigation.
Okay, I'm starting to see why it's important to be thorough, even if it feels a little personal.
I understand. It can be a little intimidating to open up about these things,
Sure.
especially when it comes to sexual and reproductive health.
Right.
But it's super important to remember that these appointments are meant to be safe spaces for open and honest communication.
That's a really good point. It's all about feeling comfortable enough to be upfront with your doctor.
Exactly. Healthcare providers, they're trained to create a comfortable, non-judgmental environment.
Right.
And remember, it's a two-way street. Don't be shy about asking your own questions, too. Your doctor is there to help you, not to judge you.
You tell them.
Yeah.
So it's all about building that trust and that open communication.
Exactly.
Now, the Merck Manual also emphasized this concept of shared decision-making.
Yeah.
What exactly does that look like in practice?
So it basically means you and your doctor work together to make choices about your care. You're not just passively receiving instructions, you're actively involved in the decision-making process.
So does that mean, for example, that I can choose not to have a pelvic exam if I don't feel comfortable with it?
That's exactly what it means. You always have the right to decline any examination after discussing the risks and benefits with your provider.
Okay.
It's about making informed decisions that feel right for you.
I love that. Feeling empowered and in control of your own healthcare is so important.
Absolutely. Speaking of feeling empowered, let's talk about how these visits go beyond the purely physical aspects of health.
Okay, this is where it gets really interesting for me.
Yeah.
We've talked about, the checkups and the history,
Yeah.
but it sounds like there's this whole other layer to well-woman care.
Yeah, you got it. These visits also offer a chance to discuss broader concerns
Okay.
related to your sexual and reproductive health, which are so crucial to overall well-being.
Yes. It seems like there's still so much stigma around those topics, but it's so important to be able to have open and honest conversations with your doctor.
You're absolutely right. Whether you want to talk about contraception options, safe sex practices, or even just your overall sexual well-being, this is the time to do it.
Yeah.
Your provider is there to give you accurate information and support without judgment.
I think that's so important for people to hear. It's not just about preventing SPIs or unplanned pregnancies.
Right.
It's also about feeling confident and empowered in your own sexuality. And being able to have those open conversations with your doctor is such a huge part of that.
Couldn't agree more. These visits are really about taking advantage of this dedicated time to have that dialogue with your provider and advocate for your needs. Don't hold back.
Great advice. Now, we've covered a lot about communication and the overall scope of these visits,
Yeah.
but I'm curious to get into some specifics about what happens during the physical exam itself. What can someone expect when they walk into that exam room?
So it usually starts with a general assessment of your overall health. This can include things like checking your blood pressure, listening to your heart and lungs,
Okay.
and even feeling your neck to check your thyroid gland.
Wait, why the thyroid? Is that really relevant to women's health?
You might be surprised, but absolutely.
Okay.
It all comes back to that holistic approach, right? So the thyroid, it plays a big role in hormone regulation. And believe it or not, an overactive thyroid, we call that hyperthyroidism,
Mhm.
can actually cause irregular periods.
Wow, I'm learning so much today. It's amazing how seemingly unrelated things can be connected.
Exactly. And they'll be looking for signs of other hormonal imbalances too.
Okay.
For instance, things like acne or unusual hair growth patterns can sometimes be indicators of something deeper going on.
So it's really about paying attention to all those little details. What else is involved in the physical exam?
Well, they'll likely examine your abdomen as well, gently pressing to check for any masses or enlarged organs and listening for any unusual sounds.
Yeah.
It might involve a little bit of pressing and prodding, but it shouldn't be painful.
Okay, good to know. And I imagine if something feels uncomfortable, you can always speak up, right?
Absolutely. Communication is key throughout the entire exam. Don't hesitate to let your provider know if you're feeling any discomfort. They want you to feel as relaxed as possible.
That's really reassuring. Now, we talked briefly about sexual and reproductive health earlier,
Mhm.
but are there specific things that people should be prepared to discuss during that part of the visit?
So this is really where those open and honest conversations come into play. It's your chance to bring up anything that's on your mind,
Go.
whether it's concerns about your period, questions about different contraception options, or even just wanting to talk about your overall sexual well-being.
Right.
No topic is off limits.
It's so important to feel comfortable bringing those things up? And I know for some people, the idea of discussing sex with their doctor can feel a little awkward, but it really shouldn't.
You're right. It can feel awkward at first, but remember, your doctor is a professional. They've heard it all before,
Right.
and they're there to help you, not judge you.
Exactly. So don't hold back.
Yeah.
It's your health, your body, and you deserve to feel comfortable talking about it openly. Now, I know in addition to the general physical exam and the discussions about sexual health,
Yeah.
there are also specific screenings and vaccinations that might be recommended during a well-woman visit. Can you tell us a little bit more about those?
Absolutely. So, depending on your age and individual risk factors,
Okay.
your clinician might recommend screenings for things like high blood pressure, high cholesterol, and diabetes. And of course, there's the pap smear
Right.
for cervical cancer screening, which we talked about earlier.
Right. Those are all crucial for overall health. What about vaccinations? I thought those were mainly for kids.
Well, while many vaccines are given in childhood, there are some that are particularly relevant for women's health. So the HPV vaccine, for instance, is highly recommended for women up to a certain age, and there might be other vaccines you need based on your specific circumstances.
So it's always a good idea to ask your provider
Yeah,
about what's recommended for you.
exactly. It's all about being proactive and staying informed about your health.
It's really impressive how comprehensive these well-woman visits are. It's like a one-stop shop for taking care of your overall health and well-being.
That's a great way to put it. And remember, the goal is to be proactive.
Mm-hmm.
By having these regular checkups and open conversations with your provider, you can stay informed, address any concerns, and ultimately, feel more empowered to make choices that are right for you.
That's a perfect note to end this part of our deep dive on. But we're not done yet. We'll be right back with even more insights on well-woman visits. Stay tuned.
Welcome back, everyone. Before the break, we were talking about just how much well-woman visits cover.
It's like a tune-up for your entire well-being. But one thing I'm still kind of curious about, we've talked about the importance of these visits at like different life stages.
Right.
But like, how often should you actually be going?
That's a great question, and it's one a lot of people have. The recommendations, they can vary a bit, but generally the American College of Obstetricians and Gynecologists suggests well-woman visits every year for women who are sexually active
Okay.
or 18 years or older.
Okay, that makes sense. So it's not just like a one-time thing, it's
Yep.
about building this like consistent routine for your health.
Exactly. It's about creating that ongoing relationship with your provider
Right.
and making sure your healthcare stays on track as you move through different phases of life.
And speaking of those different phases, I know like a lot of women might have like specific questions or concerns depending on where they are, like during pregnancy
Right.
or menopause. Can these well woman visits address those too?
Absolutely. Well, woman care is designed to adapt to your individual needs,
Yeah.
no matter what you're going through. So during pregnancy, you'll have prenatal appointments that are very focused
Hmm.
on the health of both you and your baby. And as you transition into menopause, there will be discussions about managing those symptoms or exploring hormone therapy options if needed.
That's so reassuring to know. It really underscores that personalized approach we've been talking about.
Yeah.
Now, before the break, we were starting to get into like the nitty-gritty of the physical exam itself.
Yes.
What else can someone expect during that part of the visit?
So we talked about the thyroid check, but another thing clinicians will often do is examine your skin.
Oh,
They're looking for any unusual moles or growths, signs of hormonal imbalances, or even skin conditions that could be related to, underlying health issues.
oh wow. So it's like a full body scan in a way?
Pretty much. They'll
Oh,
also likely check your breasts for any lumps or abnormalities. And, depending on your age and family history,
sure.
they might recommend a mammogram, which is a specialized X-ray used to detect breast cancer.
Right. I know mammograms are super important for early detection.
Yes.
Anything else?
Well, depending on your individual circumstances and risk factors, they might also suggest screenings for sexually transmitted infections or STIs.
That makes sense. It's
Yeah.
all about staying proactive and catching things early.
Exactly. And remember, it's perfectly normal to feel a little anxious or uncomfortable during some parts of the exam,
Sure.
especially if it's your first time or you've had a negative experience in the past.
Yeah, I think a lot of people can relate to that. It's a very vulnerable situation.
Yes.
What advice would you give to someone who's feeling, nervous?
Well, don't be afraid to speak up. Your comfort is a top priority, and a good provider
Right.
will always listen to your concerns and make adjustments as needed. For example, if you're feeling particularly anxious about a pelvic exam, you can ask for things like a smaller speculum,
Right.
a warm blanket, or even just to take a few deep breaths before they begin.
Those are really helpful tips. It's all about
Mhm.
advocating for yourself and making sure you feel as comfortable as possible.
Absolutely. And remember, it's okay to ask for a chaperone to be present during the exam if that makes you feel more at ease.
That's a good point. Sometimes having that extra support can make all the difference. Now, shifting gears a little bit, we've talked a lot about the medical side of well woman visits.
Yes.
But it seems like there's also this strong emotional component to these appointments as well.
You're right. It's not just about, checking boxes
Yeah.
and getting tests done.
Right.
It's also about having a space where you can feel comfortable talking about your feelings and concerns.
Yeah, I think that's so important. It's it can be really hard to open up even to close friends and family about, things that are going on with our bodies and our health.
You hit the nail on the head, but having that open line of communication with your doctor can be, incredibly beneficial. It can help you feel heard,
Right.
supported, and empowered to take charge of your well-being.
And it's not just about talking about physical symptoms, right? It's also about addressing the emotional
Yes.
and mental aspects of women's health as well.
Absolutely. Things like stress, anxiety, body image issues, relationship problems, these are all things that can, impact our overall health. And a well woman visit can be a good opportunity to bring those concerns to the table.
Yeah, I'm so glad you mentioned that. I think sometimes we tend to compartmentalize our health, focusing on the physical while neglecting the mental and the emotional. But it's all interconnected, isn't it?
It absolutely is. Our mental, emotional, and physical health are all intertwined. And a good healthcare provider will understand that and take a holistic approach to your care.
So what advice would you give to someone who might be hesitant to bring up, emotional or mental health concerns during a well woman visit?
Well, I would say first and foremost, remember that you're not alone. So many women, they experience these types of challenges, and your doctor is there to listen and offer support. Don't be afraid to be open and honest about what you're going through.
Yeah, that's so important. It's about creating that safe space where you can truly be yourself and express your concerns without fear of judgment.
Exactly. And if you're finding it difficult to articulate your feelings, you can always write them down beforehand.
Okay.
Or even bring a friend or family member for support.
Those are great suggestions.
Okay.
I think it's also important to remember that finding the right healthcare provider
Yeah.
is key to having these open and honest conversations.
Absolutely.
Not all doctors are created equal. And it's okay to shop around until you find someone who you feel comfortable with and who truly listens to your needs.
You're absolutely right. It's a partnership,
Hmm.
And you need to feel like you're on the same page with your doctor. Don't settle for anything less.
Well said.
Hmm.
We've covered so much ground today, but I feel like we've only just scratched the surface of all the things that, like, well-woman visits can encompass.
It's true. There's so much more we can delve into.
Right.
But I think we've given our listeners a great foundation to build on.
I agree. And we've got one more segment to go.
Yes.
We'll be right back with some final thoughts and takeaways on how to make the most of your well-woman care.
Welcome back to the final part of our deep dive into well-woman visits. I have to say, I'm feeling so much more informed and empowered after all the insights we've uncovered today.
Me too. It's been great to break down all these different aspects and really show just how comprehensive these appointments can be.
There really are so much more than just like a quick checkup.
It's about taking this like proactive and holistic approach to your health at every stage of life.
Exactly. And it's all about, feeling confident and comfortable in those conversations with your healthcare provider.
Speaking of feeling comfortable, one thing that keeps coming up for me is the importance of finding a provider who's truly a good fit for you. Any advice on how to go about doing that?
That's such a crucial point. It's like any relationship, right? You need to feel a sense of trust and open communication. Start by asking for recommendations from friends, family, or even your primary care doctor. Online resources can be helpful too, but always, take those reviews with a grain of salt.
Good advice. I know some people feel awkward about like shopping around for doctors, but it's your health.
Yeah.
You deserve to feel good about who you're entrusting it to.
Couldn't agree more. And don't hesitate to schedule a consultation before committing to a new provider. This is your chance to get a feel for their personality, communication style, and see if you click.
It's like a first date for your health. And while we're on the topic of feeling comfortable, I want to circle back to something we touched on earlier, mental and emotional health. It's so important, but I know it can be hard to bring those things up, even with a doctor you trust. Any tips on how to start those conversations?
First, remind yourself that you're not alone. So many women struggle with these issues, and a good provider will understand that. Start by just acknowledging how you're feeling, right? You could say something like, I've been feeling really stressed lately, or I've been having some anxiety. Just getting those words out can be a huge relief.
Yeah, it's like breaking the ice.
Yeah.
And from there, your doctor can help guide the conversation
Right.
and offer resources of support. I think it's also important to remember that you don't have to have all the answers or a perfect diagnosis to bring these things up. Sometimes it's just about expressing how you're feeling and seeking support.
Absolutely. And if you're finding it difficult to articulate your feelings, you can always write them down beforehand or bring a list of questions or concerns.
That's such a good idea. Sometimes having those notes can make all the difference in feeling prepared and confident during those conversations.
It's all about empowering yourself to advocate for your well-being.
Okay, so we've talked about finding the right provider, feeling comfortable discussing mental and emotional health, and really just the overall importance of these well-woman visits. Any final words of wisdom for our listeners as they navigate their own healthcare journeys?
Remember, knowledge is power. The more you understand about your body and your health, the more equipped you'll be to make informed decisions.
Mhm.
Don't be afraid to ask questions, advocate for your needs, and remember that you are your own best health advocate.
That's such an important message. It's about taking ownership of your health, not just passively going through the motions. And if there's one thing I hope our listeners take away from this deep dive, it's that well-woman visits are not something to be feared or dreaded. They are an incredible resource for women of all ages, offering a chance to connect with a healthcare provider, get personalized advice, and really just take a proactive approach to their well-being.
Well said. These visits are about so much more than just checking boxes. They're an investment in your health, your happiness, and your overall quality of life.
I love that. It's about seeing these appointments not as an obligation, but as an opportunity to prioritize yourself and your well-being. And hey, if you ever have more questions or want to delve deeper into specific topics related to women's health, you know where to find us. We'll always be here with more deep dives and insights to help you stay informed and empowered.
Absolutely. We're always happy to help demystify the world of health and wellness. Thanks for joining us.
And a huge thank you to our amazing listeners for tuning in and diving deep with us today. Until next time, stay curious, stay informed.